Welcome back, everybody, to Toula's Tips for Caregivers. If you've just tuned in, I need to remind you that I've got a couple of gift certificates to give away to the first 3 to 4 callers. Riverfront Cafe, wonderful place in Riverside for lunch, for dinner. Mediterranean restaurant, my favorite for Italian and Greek food. As a matter of fact, I was there for dinner last night, and I had the Dr. Bowden special. Now, if you're curious as to what that is, you just need to call me. And I've got 2 $500 gift certificates to go towards your planning for Hardage Giddens. Also, I want to let you know that my guests today are Andrea and Royce Hart, the owners and directors of Bright Star Home Care. And they do some things that do distinguish them a little bit from some of the other home care agencies in town. And we were talking about that a little earlier because there are so many home health agencies in this town. Andrea, how does a person know how to choose? What do they look for?
Well, some things they should look for is obviously they need to make sure they're licensed. That always helps.
That helps a whole lot.
That's the first thing. And if I was a person that needed a home health agency, I would really, research them, look at their website and things of that nature, but also look at their screening processes for their caregivers.
There you go.
Are they doing 50 state background checks? What are they requiring? Are they requiring no experience? Do they want caregivers with 1 year experience, what those types of things. And then sometimes just call them, and ask them the questions that you need answered. And from there, I think you can make a pretty educated, decision on that. And one thing I do like about us, Bright Star, a lot of people, we've been hiring like crazy lately, and all the caregivers, when they come in, they always say, here, it's really hard to get in and get hired with you all. And that's a good thing and a bad. It's a good thing to me because that means that we're really looking for very excellent and quality people. Because we have a lot of standards that are in place.
And you've got excellent high standards, and that's important.
Yes, it's because these people are going to your home.
Right.
And with us, we service children. From nanny to babysitting and special needs children. And with the state of what people are doing to children nowadays, you can never be too careful. And I know I wouldn't want anybody in there with my kids, So definitely that's why we take a lot of care in doing that.
So I know you've done the right things that you need to do. You're licensed, bonded, insured, and all those things.
Yeah, and we don't have 1099 workers, which means they're under our insurance, which is really why we're paying a lot of attention to who we hire, so if something happens, definitely we'll get dinged, and we have insurance for that. And you'd be surprised, a lot of agencies don't. They just hire contractors.
And also another thing that's important to a lot of elderly people, not elderly people, but one thing that's really important is that a lot of people don't know that it's illegal for some of the companies to operate out of their basement, or, that was a joke.
Yeah, out of their homes or whatever. Open a storefront out of your home or whatever. You have to have your own freestanding office, and there is a lot that you have to go through ACA to be licensed.
Florida ACA is pretty brutal.
Yeah,
which is good.
That is good. I mean, again, it ensures the quality. Before we went on the air, you told me about another step you're taking, Andrea, to ensure quality. Joint commission. Tell me about that.
Joint commission certification. It's been the story of our life for the last probably 3 months now. Getting ready for that. We're having it's a national certification, and the way I usually explain it to individuals is that it's like the good housekeeping stamp of approval.
There you go.
For we're home care, but all the hospitals have to have Joint Commission certification.
That's right.
A lot of your Medicare home healths have to have the Joint Commission certification, but it's just another level of accountability. And what that ensures is that it's a national organization, and they come in and they do checks, surprise checks and different things to make sure you're doing what you say that you're doing. And with us being who we are, people of faith, we do believe in integrity. So we welcome having that accountability, so as right now we're pulling out our hair, but
Yeah, you'll be glad when it's all done and say we really welcome that accountability later. But it is a very arduous process to go
Yes,
through.
it
They
is.
really do scrutinize you with a fine-tooth comb.
which is good.
It is good.
We need that level of accountability in home care. The way things are going right now, we do.
Well, yeah, because there are so many of them, and like you alluded to, Royce, there are a lot of folks out there doing it, not doing it exactly by the book. So, caregivers, it is really important to investigate the home care agency that you decide to employ for your loved one. Again, because as Andrea said, that person's going to be coming into your home, and oftentimes you're not going to be there, and it's just really important to be able to trust the credibility of that organization so that they will take good care of your loved one. I'll never forget years ago when I was working for a home care agency, I was on a talk show, it was TV, and the gentleman sat down and crossed his legs and asked me a question that we hadn't discussed beforehand. You know how that goes. And he said, how do I know that this home care provider isn't just going to come in and steal all my silverware? You know?
And that happens. You know?
Yeah, so you have to go through the appropriate processes and to do the diligence
Yes, you do.
to make sure that you've got the right type of people, caregivers, and the background screens that you do a lot to ensure that.
Yeah,
So,
we do the drivers, we do DUIs, we do anything that they'll let us look at, we look at it because
Well.
if something were to happen in the home, that person has to transport.
Exactly.
And you want somebody that knows how to drive and has a license,
Very important.
to
Very
be able to
important.
transport your loved one.
Well, that goes into a little bit. You mentioned transportation. Let's talk about some of the services you provide, Andrea.
Okay, well, we call it life care, kid care, and staffing. We do send nurses and sitters to the home. We'll even send them to your assisted living facility if you have a parent or somebody that's in assisted living, independent living, just if they need a little extra help.
Gotcha.
Or even to the hospital. We'll send them there. And that's things like companionship, laundry, housekeeping, meal planning, shopping errands, transportation, just getting them to church, wherever. And then we obviously have the skill component, which we'll be starting to do the skill component late July, August.
Tell me what that involves.
That's just sending any type of health provider, like a nurse, certified nursing assistant, LPNs, because we're a staffing agency also.
Okay.
We have access to almost everything except the doctor to send to
So
your
RNs,
home.
LPNs, certified
LPNs,
nursing assistants.
Yes. And what's neat about us, sometimes when you go to certain places, they'll just have either your regular CNA or a RN. But we have everything in between. So if you have a diabetic person, you don't need an RN to give an insulin shot. We can send an MA or
Right.
an LPN, which helps on the cost versus
Of
sending
course.
the RN. But what's nice about Bright Star is that we do have RN oversight every case, whether it be just nanny babysitting all the way up to the highest skilled physical therapy and things of that nature. We do have a RN, two RNs actually, two directors of nursing that oversee every case. We have weekly clinical meetings and things like that, because then that goes with the Joint Commission, and just we really believe in having quality of care, and all the caregivers can actually call the directors of nursing and asking questions whenever. Even the patients can also call, because sometimes things
And
come
they
up.
should. They should
know.
feel free to do that.
Yeah, so our
Sure.
nurses will talk to the doctors, whatever's needed. We treat every patient like their family.
Do you get most of your referrals from hospitals as patients are going home?
I'm sorry.
Do you get most of your referrals from hospitals as patients are going home? Do you get a number of referrals from the hospitals?
Not as of yet.
Okay.
We're very new to the hospitals, and we're just really getting our name out there. So a lot of the hospitals really don't know about us just yet.
Okay.
So that's actually a part of my job, and I'm trying to really get out there to know a lot of those social workers and to get them familiar with us and the excellence of our company. So
It'll come in due time.
yeah, well, they say that hopefully once we really start going, they say that the best referrals come from word of mouth.
Mm-hmm.
So once we really start going in Jacksonville, getting getting those clients, they'll see the excellence in our company, and we will get those word of mouth referrals.
Yes, and that's what really means the most, is other folks telling people about the wonderful services that you have to offer. I mentioned that because I used to do that, and I know the importance of transitioning someone from the hospital
Yes.
to the home, and there's a lot of care that needs to be provided at that time. And I know you want to talk a little bit about what's happening in the hospitals today. For those of you caregivers who may not know, hospitals, I think it started this in July actually. Starting next month, hospitals will be dinged, if you will, on readmissions within 30 days, because that means they probably didn't do a really good job of planning and teaching caregivers on how to take care of their loved one. And when I say dinged, I don't just mean on chart, it will have to do with their Medicare reimbursement as well. So hospitals are ramping up.
They need to.
They do. They really need to be able to give caregivers and family members adequate teaching on how to care for their loved one. And that's where you can come into play.
Right, we have some really, really good programs, which I guess we'll talk about after break.
We'll talk about it after the break. That's kind of what I was leading up to. You're listening to Toula's Tips for Caregivers on Talk Radio 600 WBOB. We'll be right back.